Welcome to this presentation on caring for someone with mental health issues. Data shows that we have an increase in anxiety, depression, addiction, and other mental health issues across our society. Now, this can compound issues for caregivers, which we'll discuss during this presentation. I'm Dr. Elliot Montgomery Sklar. I'm a professor of health science at Nova Southeastern University in Florida. I've worked as an educator, researcher, and leader of community-based health programs in the US and Canada for almost 20 years. I've worked to run and to evaluate programs to support aging and caregiving throughout my career.
Thank you. My name is Lucy Barylak, and I received my master's degree in social work at McGill University. I was the founder and longstanding manager of the Caregiver Support Center. I spent my whole professional career developing services for caregivers, as well as managing research projects to identify caregivers' needs. I have published numerous articles and have presented at major international conferences on my research finding. I'm presently supervising students at the School of Social Work at McGill University. I also want to share that I was a caregiver for my mother. People are often surprised to learn that the rates of mental health disorders are rising faster among baby boomers. It's estimated that 20% of people aged 55 or older experience some type of mental health issues, and the number of older adults with depression is expected to double between 2010 to 2030. We go through a lot of changes as we age, such as death of loved ones, medical problems, or retirement that can make us feel uneasy, stressed, or sad. The role of caregiving can cause a situational mental health issue. For example, in some instances, a diagnosis like dementia or Alzheimer's can cause depression for both the person who's diagnosed as well as for the person caring for them. But this can be much more broad, as many older adults and even younger adults with certain health issues that require a caregiver at times may also experience mental health issues. Social isolation or the stress of acting as a caregiver can also negatively impact older adults' mental health. It's normal to go through an adjustment period after experiencing this kind of life event before starting to feel well again. But if these feelings persist and begin interfering with daily life and normal functioning, it's time to seek the treatments needed to feel better. Unfortunately, older adults are often hesitant to reach out for help due to persistent stigma around mental health issues and generational differences in how those disorders are perceived. This is one of the reasons why suicide risk is highest among older white men, more than among any other group. And aside from all the data we know, and I'm sure many of you participants today know, that mental health issues are underdiagnosed and underreported. We use the more basic term when we're discussing this. We call it mental health issues for our presentation today, because caring for someone with mental illness can vary tremendously. You may know someone who's being treated for depression and usually seems fine, but might be going through a depressive episode. For other people suffering from depression, their experience may be very different.
It's so true. And Lucy, what you shared is so important, often as well, because it's not uncommon for physical health issues as we age to trigger mental health concerns or issues. They can often exist together, even if it's just situational. There are a wide range of mental health conditions, disorders that affect mood, thinking, and behavior. Some examples of mental illness include depression, anxiety disorders, even schizophrenia, eating disorders, addictive behaviors, some of which may be more lasting and some of which may be more situational. Symptoms can also fluctuate, and it can be frustrating, certainly, as a caregiver, to observe and to go through that experience with a care recipient. Now, these are just some examples. There are some mental health conditions that are more lasting as well, and some diagnoses like dementia and Alzheimer's can actually first show symptoms in mood and behavioral changes before symptoms of memory loss. This is especially true among younger adults who are diagnosed with young onset dementia. So, caring for or even living with someone whose mood and behavior can fluctuate can make it very hard. And, you just don't know what is a symptom of an illness versus what is just a strange behavior if a diagnosis is not made. So, one of the first challenges that many caregivers and many patients experience can be a diagnosis. And many people are really reluctant to seek care because they don't want to be labeled or diagnosed as having a certain condition. But there are currently no definitive blood tests that can diagnose depression, for example. Now, despite this, doctors may want to do other tests to ensure that changes in mood may not be related to physical conditions. So, a physical exam is always suggested to help rule out other physical symptoms or diseases that could be causing changes in mood or behavior. That can include lab tests, for example, to check your thyroid function or your cortisol. A psychological evaluation may also be done to evaluate your mental health by either a doctor or mental health professional who would speak with you about symptoms, thoughts, feelings, and also behavioral patterns. It's very common for people to be asked to fill out questionnaires or to have someone help in answering those questions. Now, sometimes it's very difficult to know exactly which mental illness may be causing certain symptoms, and there may be multiple diagnoses. But taking the time and the effort to get an accurate diagnosis will help to determine appropriate treatment. The more information that you have as a caregiver, the more you can be prepared to help in supporting your care recipient in working with a mental health professional to understand what their symptoms might represent. And as a caregiver, it certainly is very helpful to know as much as you can about that mental illness. And it's also just as important for an older person with symptoms of depression to seek treatment as it is for someone who's younger. Lucy talked a bit about the stigma associated with mental health and older generations. And the impact of depression on health in older adults can actually be quite significant. There's a lot of research that has reported that depression is associated with worse health in people with chronic conditions like heart disease, diabetes, and those who have had a stroke. Depression can also complicate the treatment of these conditions, making it more difficult for someone to care for him or herself and also to seek treatment when needed. Among older adults, depression may also be disregarded as frailty or viewed as an inevitable result of life changes, chronic illness, even possible disability. But recognizing the signs and seeing a health practitioner is the first step to getting treatment, which can make a true difference in someone's quality of life. Now, this is also where counseling, talk therapy, as it's sometimes called, and medication in conjunction can be helpful, as your care recipient's doctor may recommend that based upon an evaluation. But counseling can equally be helpful for caregivers, which Lucy will discuss. I also like to think of anxiety and depression like allergies. And I think it's a really good analogy because sometimes pollen and seasonal allergies, trigger my sinuses. It can be a little bit more congested. I might need some eye drops, but at other times, my allergies might be fine. So for other people, their allergies may be more severe and more consistent, like people with asthma, for example, who are allergic to dust and grass, things that are pretty much everywhere. So I think this analogy has worked with other groups of caregivers that I've talked to because it helps to remind us that during more stressful times, for example, people who suffer from anxiety and depression might have more challenges with healthy coping. If you think about it, many caregivers themselves have had periods of challenge, and as a result, that has certainly perhaps impacted relationships around the caregiver. It can be very challenging to love and to care for someone with mental health issues because of the challenges inherent with mental illness. A bad knee, for example, can impact someone's mobility, but poor mental health can affect everything, including that person's desire to even be mobile.
There are some common key challenges that caregivers of individuals with mental health issues experience. So there can be emotional and physical burnout. So what does it look like? Constant vigilance and stress can lead to fatigue, depression, or anxiety in caregivers. People with mental health issues may experience mood swings, aggression, or delusions, which can be emotionally taxing and can leave caregivers not knowing how to respond. The best thing you can do is not to engage or challenge them and to distract or redirect or give them an opportunity, both of you, to cool off. There's also a lack of training or knowledge, as Elliot was saying. Many caregivers, especially family members, aren't equipped with proper training and handling psychiatric symptoms or behavioral issues. It's important to learn as much as possible about the specific illness that your care recipient has and what supports are available for you and for them in your community. But let's talk about stigma. This is really the big one. Still, in 2025, caregivers may feel judged or alone, especially if mental illness is misunderstood in their community. Think about your own upbringing and how mental health was discussed or viewed in your family. This can be helpful in understanding your own feelings around this issue and those in your extended family or community. This circles back to the isolation many caregivers feel resulting from devoting time to caregiving and possibly concealing what is going on because of the stigma or the shame. Stigma and shame around mental health issues is a good reason to join support groups and to seek out help so that you can benefit from the experience of others in a safe and supportive environment, which can also help you to learn more about the illness.
That's so true. Stigma is a very important challenge. Older generations are less open about mental health than younger ones, which is supported by a lot of research and by the number and ages of people who are receiving mental health counseling. It's quite interesting. Younger adults are more open about their mental health challenges, having grown up during a time when we are discussing mental health more openly as a society. But still, stigma plays a barrier to diagnosis and treatment of mental health issues. Many people are averse to the idea that medication might also help to treat their mental health concerns. And so, as a caregiver to someone who may suffer from mental health issues, we know that medication can be very helpful, but helpful only when it's taken properly. And it's important to understand the role of medication and their potential side effects, which is often why many people go off of medications. Now, we've included information about different classes of medications on this slide, which you can review and reference at your convenience. We need to recognize that these medications have adjustment periods as well. It can be extremely challenging to provide care for someone who is suffering from a mental health episode, or to bear with them as they adjust to medications, which can impact sleep, sexual function, weight, mood, and behavior. Medications are very helpful, as I said, but only when people stay on them. So you need to be a little bit vigilant sometimes as a caregiver in helping to support someone through those adjustment periods. Some medications have significant side effects, others are more mild, and again, they do vary from person to person. But one of the keys for successful treatment is to be open and honest in your communication with a healthcare provider.
Thank you for that, Elliot. So now we're getting to the point of how do I give emotional support to the person I care for? This is especially why learning about the illness and treatment can help you understand how it affects the person you care for and might make you feel more confident caring for them. It can also better inform you about what you are going through as a caregiver. You could learn about the illness by going to support groups or services. There, you could meet others who may have been through similar experiences and get support and information. It can also be a safe place to express anger and resentment, which many times that happens and it's normal. In a safe place, so you can actually talk about your feelings. It could be hard to care for someone with mental illness, which can impact your interactions and how that person behaves. So, how do I give emotional support to the person I care for? One of the most important things is offer to listen to the person you are supporting. Listening to someone doesn't mean you have to say much back to them or come up with solutions to their issues. Sometimes they may just find it helpful to just talk to you about their problems and to know that you are there and you are actually listening. So don't be afraid to ask them questions about how they're feeling and listen to their answers. If they aren't feeling great, ask them, you can ask, what can I do to help? Make sure you don't take on too much on yourself and becoming overwhelmed. So ask yourself, how do I encourage the person I care for to get treatment? You might find that the person you are supporting doesn't want to get treatment. This might be because there's many reasons, but that's how, people with mental health issues, many times, they don't want to accept it. Many times they don't think that they need help and it will get better on its own. They might think that treatment, they don't believe that the treatment will work. They don't understand that they are unwell. They might be scared of what will happen to them if they tell their doctor how they feel. They may be worried what other people might think. They may be, maybe afraid to talk about it if they're working or if they're a student. They might feel helpless and are reluctant because of the past experience that they had. So if the person you care for doesn't want to get help, it can be very frustrating, but please don't give up. If someone you care for once doesn't want to get help, you could try again. Talk to them about how they feel. Asking them these questions are important. Ask them why they don't want to get help. Explain that you are worried because they seem upset, that they're down, they're stressed, they're just not happy, and you want to help them because you love them and you care for them. Explain what kind of help they could get. So it's important for you to know what services are available in your community. Offer to help them to talk to their doctor or offer to talk to their doctor before their appointment, obviously with their permission. Some people might refuse to get help. Even if you try to support them, it's important not to give up, as I said before, and stay hopeful. It might take a while before they get help that they actually need very much. So, looking after yourself emotionally and physically is really important. We always say that no matter who you're caring for. So, if you're caring for someone with mental illness, you might find it stressful and difficult. It's important to look after your own health and your own well being. You can try some of the following things to help look after yourself. Understand what you can and cannot do as a carer. That's so important. Understand what the person you care for can and cannot do. Don't have unrealistic expectations of them. Give yourself time to do things you want to do, such as a hobby or leisure activities. You need to have respite. It's a difficult situation to be in. Try and keep physical activities and have a well balanced diet So important. Sleep is really it's, something that you really need to know. Now, set your boundaries. It's important to be able to set boundaries. And more than anything, as Elliot and I always say, there's two people in this relationship. One does not outweigh the other. So please take care of yourselves.
It's so important. We have to care for ourselves, as you said. Now, many caregivers have asked in the past what to do if they feel that there is a crisis when they are providing care for someone with mental health issues. If you feel like you're in a crisis where your safety may be affected, then obviously, call 911. But if there is no immediate urgency, there is the 988 Suicide and Crisis Lifeline that you can communicate with by phone and also by text. And also, the SAMHSA, the Substance Abuse and Mental Health Administration, has a national helpline at 1-800-662-HELP. We've also included some health hotlines here that you can reference and call at your convenience, including a crisis text line. You can text hello to the number 741-741 24 hours a day. Now, some of these resources do vary, so it's a good idea to see what might also be locally available to you, and you can reach out to 211 in any local community with any phone to find out resources that might be close to you. Another suggestion for many caregivers is to use artificial intelligence. We all have that now and on our phones and at our disposal. You don't need any special training or education. Instead of using Google, for example, to just simply look up support groups for mental health, you can use a different kind of prompting by asking a question. What are some local support groups for mental health near me? And that will give you actually a more customized result that can be really, really helpful. And as always, feel free to reach out to the WellMed Charitable Foundation. You can reach someone by phone at 1-866-390-6491, as well as at the email address caregiversos@wellmed.net. Thank you so much for watching this presentation. Wishing you well.
Thank you and goodbye.